Hello again, my name is Dr. April Morrison. I'm a graduate faculty member in the East Tennessee State University College of Nursing. This is part 2 of the pulmonary clinical pearls. In regards to the pulmonary function test, we are almost done. Just bear with me a few more minutes, and we're just going to skip down to the slide that we left off at. We were talking about the different types of lung diseases and what exactly that's going to look like whenever you perform a pulmonary function test. We looked at asthma and how you may actually see a FVC that's actually pretty normal. However, when you look at the ratio over that 1 second, when you divide those two numbers, it's actually going to be decreased. It's going to be less than 0.7 or less than 70% of what that patient should have been able to do had they not had any obstructive diseases. Again, COPD, this is what it's going to look like. As well, you're going to see a reduction in the FEV1, but in addition, you're also going to see a reduction in the FVC as well, just like we saw up here on this particular curve over here on the right upper hand side. With these tests, again, pre and post bronchodilator, your spirometer test is going to actually improve on your patient with a restrictive or obstructive disease, like COPD. So how do I know what my PFT is actually showing me? There is a great way to look at it. So the first thing you want to do is say, I'm going to look at my forced vital capacity, so my FVC. Is it greater than 80%? If yes, then it indicates that there's no restriction. However, if your FVC is less than 80%, so no, it's not greater than, you either have a restriction or an obstruction. The next thing you want to look at, if you have that, is look at your FEV1 FVC ratio. If that ratio is greater than 70% or 0.7, there is no obstruction. However, if that ratio is less than 70% or 0.7, you have an obstruction going on. Next, you want to look at the total lung capacity. This is an important number. This again is based on all of that information we looked at previously. If your total lung capacity is greater than 80% of the predicted, then you're looking at an obstruction. If your total lung capacity is less than 80% of what is predicted for your patient, you're actually looking at a restrictive airway disease. This actually can be drawn in a flowchart, which I didn't do for the sake of this presentation, but this is a stepwise way that you can look through a PFT and do your own interpretation to determine A, is there a problem, and B, if there is a problem, what kind of problem are we looking at, obstructive or a restriction problem. There is, in clinical practice, some diagnostic criteria that has been given to us. If you go online and look up the COPD GOLD criteria, you can actually diagnose it based on symptoms. You can think about things like exposure, so maybe they had an environmental exposure to asbestos or something of that nature. Maybe they've been a long-term tobacco smoker. And then ultimately, for a COPD diagnosis, you really do need some spirometry, which again can be done in your office. Based on the spirometry, we can classify this patient based on their airflow limitation severity and diagnose them with the different steps of COPD that they have. So they can be a GOLD 1, a level 2, 3, or 4, based on the results that we get from their test in the office that day. So the asthma diagnosis, it can actually just be made on symptomatology or their history. But again, the gold standard for an asthma diagnosis would be a PFT, which can not only always be done. If you want to know more information about asthma diagnostic criteria, you can go back and look at the asthma video. With asthma, you want a confirmed variable expiratory flow limitation. That's what you're going to see. And you have to have documented airflow limitation. Again, that magical number of the FEV1 to FVC ratio is going to be reduced. And then, ideally, PFT should be done prior to the asthma diagnosis, but again, it is not always possible. Here is more diagnostic criteria for adults, adolescent, and children. This is actually from the GOLD criteria. I would really encourage you to go over and to read that information that is presented there. These are some references that were used in the presentation today. If you have any questions, you can actually email me at morrisonah1 at etsu.edu. I would be happy to talk with you. If you have any concerns about this presentation, that would also be great. I would love to talk with you. I hope you have a great day.